Hi, welcome to the Ohio Myeloma Initiative. My name is Craig Hoffmeister from Ohio State University. The goal of the Ohio Myeloma Initiative is to contact, assist, and ultimately enroll every MGUS or monoclonal gammopathy of undetermined significance, multiple myeloma, and AL amyloidosis patient in Ohio based on the following three principles. Every myeloma patient should know about the initiative, every myeloma patient's experience should be recorded, and all registered patients should get value from participation. Most myeloma patients are diagnosed in small community practices by private practitioners. They've never heard of myeloma and often have difficulty distinguishing it from melanoma, and they are treated primarily by physicians that have very few myeloma patients in their clinic. In Ohio, we have approximately 150 oncologists. Each of them see a handful of myeloma patients per year. In essence, each myeloma patient's experience in Ohio is taken as a single patient lost amongst many physicians. But what if things were different? What if we could connect the dots? If the experiences in one patient's clinic were connected to an experience in another, and so on, so that every myeloma patient could be somehow connected to every other myeloma patient. What we want to do is make sure patients that are seen by private practitioners have their experience recorded and have an opportunity to participate. Ideally, we would like to get the Toledo, Dayton, and Columbus community oncology practices as part of TCOP, DCOP, and CCOP to all participate and enroll patients ideally within 2 weeks of diagnosis. This could allow patients to be consented on paper in the middle of clinic, or they could enroll online at ohiomyeloma.org. Ultimately, we want to make sure that all patients at University of Cincinnati, Ohio State University, Cleveland Clinic, and Case Western are approached and at these sites work collaboratively. At each site, we want to obtain all the initial diagnostic and staging information wherever it was done. We want to follow these myeloma patients through progress notes, chemotherapy treatment records, lab reports, essentially following their primary records and recording their experience in a templated fashion in a database that's spread on the internet, where patients and researchers all have access to de-identified information. With this, it'll require that we review every bone marrow biopsy, track the timing and results of all treatment information, and ultimately make anonymized information available. If we connected the dots for patients so that their experience was taken as a group, they would know where to turn for more information, they would have ways to connect with other patients in their area, and that they would know that their doctor was connected to a team of doctors focused on their cancer. They could easily find a clinical trial, and they could look to find out what to expect from their cancer in the future based on hundreds and sometimes thousands of patients that have walked the path before them. Sometimes knowing exactly what's ahead is not pleasant, but more information provides each patient critical and practice-changing information. For instance, with over 70 or more drugs being tested in this incurable disease, wouldn't you want to try something new? And if you knew that your disease has been treated by most of the available drugs, or had been treated by some drugs that you had tolerated poorly, wouldn't it be nice to know if there was an innovative clinical trial close to you? Most importantly, patients that are their own advocates tend to modify the health care that they receive. They change the way that nurses, doctors, nurse practitioners, and pharmacists all speak to them. And essentially, they create an environment where they can receive better care. Patient advocacy is something that the Ohio Myeloma Initiative is trying to nurture. Most of the time, data from registries go into an academic center, into a large database, and ultimately it's published. But we don't want that. We would like every patient, every researcher, to have access to the data being charted in this large anonymous database. So every patient should be able to log on and find out when is the next support group, what kind of financial resources are available, what basic educational questions could they get answered. They should be able to email and call the Myeloma Initiative to get information. And they should be able to get personalized treatment recommendations based on their specific chemotherapy exposure and what worked or didn't work for them in the past. Ultimately, we should be able to obtain aggregate survival information based on basic user-defined criteria. As an example, what we're trying to create is a web portal where a patient could log on. In this case, John Smith logs on. He finds out that his closest support group meeting is in Toledo, with a meeting tomorrow. The 3 closest clinical trials are 65, 100 miles, and 110 miles away, with a quick bit about each clinical trial. And on the right-hand side, that the following treatments are available as standard of care. And these include Kyprolis, Revlimid, dexamethasone, pomalidomide, dexamethasone, and bendamustine, dexamethasone, with or without Velcade. It's not hard, actually, to list the treatment regimens that have been reported effective and to have them based on the patient's prior treatment exposure and how did they do. Clearly, patients who've received Revlimid and dexamethasone and progressed on it, one of the things this program won't suggest is going back to thalidomide and dexamethasone, because on average, in the majority of patients, that would be not helpful. At the bottom of this slide is a relatively controversial section where it says, at your age and your treatment history, your estimated overall survival is such and such months with a range. This is upsetting for many who think about the Myeloma Initiative, but more information, especially personalized information based on aggregate data, we believe will help patients make better decisions about their care. At Ohio State, we want our patients to partner with us in research. Many patients understand the concept that medications, innovations, cell therapies, drugs, whatever, that are created in the lab eventually go from bench to the bedside and allow new treatments to be infused into patients, sometimes as a pill and sometimes intravenously. What's often not talked about is that this is only one half, and the other half is when patient samples go back to the bench to get analyzed. Without both sides, this complete circle is broken and is only half as efficient as it normally could be. The Ohio Myeloma Initiative tries to connect patients with novel translational research, allowing bench-to-bedside research to be fulfilled quickly and efficiently. But ultimately, at each center, we encourage investigators to bank samples from patients and allow bedside-to-bench research, to allow hypotheses to be generated based on small populations of patients, to develop preliminary data enough for large grant proposals to be submitted and ultimately competitively achieved. Bedside-to-bench research is critical because understanding about myeloma is something that allows us to develop better treatments and allow patients to live longer. What we try to obtain from patients is samples from patients who are newly diagnosed or treated or at the time of relapse. And these are samples that are obtained at the time that they are having blood drawn anyway, or the time that they're having a bone marrow performed as part of their clinical care. For the Ohio Myeloma Initiative, we never stick patients an additional time for research. It's always when they're having samples drawn as part of their clinical care. When each of these samples is drawn, there's an extensive clinical data for each sample about the patient and the patient's myeloma. Ultimately, things that we could ask and answer are things like prognostic markers. Are certain high-risk patients sensitive to particular drugs? And what's the function of a patient's immune system who has low-risk disease and percolates along in remission? This is currently the splash screen for ohiomyeloma.org, allowing patients to learn about the initiative, to get involved, and ultimately to sign up. Currently, we've partnered with the Ohio Department of Health and Cleveland Clinic for the Ohio Myeloma Initiative, as well as numerous oncology practices, and we're constantly on the look for more practices to partner with.